Lagos State government says it has achieved major improvements in maternal and child health across Etiosa, Ibeji, Lekki, across Etiosa, Ibeji, Lekki, and Ekpe. Speaking at the Health District 3 2025 Management Retreat with the theme, Advancing Quality Healthcare Through Technology and Data-Driven Solutions, Permanent Secretary Dr. Monsurat Adeleke announced a 102% increase in new family planning acceptors and a 36% reduction in neonatal deaths in the Ekpe axis. She also revealed that Etiosa and Ibeju Lekki recorded 0 maternal deaths in 2025, accrediting the progress to expanded emergency obstetric care training and strengthened family planning outreach. Top government officials praised Health District 3 and urged traditional birth attendants to stay better organized and support safe delivery practices.
Mr. Governor has done a number of things. The first thing, as you've heard, is to decentralize administration. So by placing very seasoned administrators down to the 6 district levels of the PHC, these are, high-ranking civil servants that have been deployed into the periphery to have an impact and make a significant difference in terms of administrative coordination. So that's working very well across all 6 districts. The next thing the governor has done is to focus on infrastructural upgrade. So we're working across all 6 districts now, renovating large numbers of PHCs. Some of them have some excessive use, wear and tear. We're putting solar panels, we're changing roofs, we're beautifying the environment, making sure that these facilities are attractive to our patients so that they can, patronize these facilities. So if you go across the state, you will see a multitude of refurbishments going on. In addition, we have new blueprint prototypes of PHCs. So many of our PHCs have been built a long time ago. Some of them are repurposed buildings. What we're trying to do now is to be focused in terms of what we do into the future. So right now we've developed 3 prototypes for PHCs, and any new building that we develop now will be these new low carbon, low energy footprint, attention to detail in terms of infection prevention, control, and things like that. The policy of federal government is that there should be 1 PHC in each ward, and in fact, if we can manage 2, that would be better. In Lagos State, we have some wards that don't have a PHC yet, and there are about 70 to 100 of those wards. So we're deliberate in trying to fill those gaps to make sure that at least every ward in Lagos has 1 functional government PHC. So in addition to that, we are driving the health insurance scheme aggressively. If you're aware that the governor released an executive order in July of 2024, which domesticates the National Health Insurance Authority Act, which now makes it mandatory for all Nigerians to own social health insurance. So Lagos is the first state to domesticate that, and we're working aggressively to make sure that we can ramp up the number of Lagosians that are exposed to the awareness and understanding of the uptake of health insurance to prevent catastrophic out-of-pocket spending. But also, the way insurance works is the more people that are in the insurance pool, the better it can manage the cross-subsidy principles of insurance.
The theme, obviously, it's about quality of care that we give to our patients using technology. The whole idea is to encourage our management team. They're doing a fine job. Ever since Mr. Governor Babajide Sanwo-Olu created 6 districts, we have seen a better quality of care. We've improved our services in every single district. And our patients can attest to that. However, we do have challenges. As you know, the state is fast, it's overpopulated. densely. We have challenges when it comes to maternal and child health, immunization, and all that. So by dividing into 6 districts, we're able to capture as many people as possible, because the aim is to ensure that every single person that lives in Lagos has access to affordable care, quality care. So this, for District 3, this management meeting is, we're all here to Cabinet to encourage them. The Permanent Secretary, Dr. Adeleke, is doing a fine job. She supports her staff, and to let them know that what they're doing is noticed, and also to ensure that the community, they continue their community engagement, they continue to do the best that they can, even under circumstances that are beyond their control. Our staff are one of the best in Lagos State. And so we're here to support the Permanent Secretary, the medical officers of health MOHs, and all the directors that actually work in District 3 to continue doing the job that they're doing, listen to their challenges, taking it back to see where we can help, where the government can help. And as you all know, our governor, Mr. Babajide Sanwo-Olu, is all about quality care and ensuring that the people that he serves, that we serve in Lagos State, get access to the good care that we're providing as best as we can. So that's why we're here. It's a retreat for them to unwind, to discuss how to move forward, to even do a better job than they're doing, to face the challenges, and also just to get to know each other even better outside the hospital environment. And that's what they're doing. And you can see they're all nicely clad in bright colors, and they're smiling, they're happy, and they're happy that we're here. And it's
I believe Lagos State is the only state that has 6 health districts headed by a permanent secretary. And this has provided healthy competition amongst the health districts, which in return has meant that the populace are the beneficiaries of this healthy competition. The health districts have been able to reach places that we could not reach before. They go to riverine areas, they go to very difficult terrains to provide quality medical services. And the health district 3 have done a wonderful job. This is their 3rd retreat, and this is the 2nd one I've attended. And I've always been impressed with how they carry out their activities. I observed that they have now a QR code. They are using technology a lot, and that is what will make the job easier and more effective. They have a QR code that I saw just now and observed that acts as a communication tool. You know, you can type and send in your request. Even those that can't write, they can leave voice messages. Now, that is thinking out of the box. That is being innovative and creative. So I want to say kudos to the Health District 3, led by Dr. Monsurat Adeleke, for doing great things. All our health districts are doing great things. And like I said, it's providing healthy competition. Each one is outdoing each other. And the beneficiaries are the patients and the good citizens of Lagos State.
3rd of the management districts that we're having since inception in 2023 by Mr. Governor, who created 6 districts, and he gave us the mandate that all of us should go out and carry out a healthy rivalry amongst ourselves in order to bring the health system closer to the citizenry. So every year when we meet up for this retreat, what we do is that we capture all what we have achieved during the course of the year, all our achievements, then we point out the challenges and we prefer solutions on what it is. So this, as usual, we have the support of the leadership, because after Mr. Governor charged us with this mandate, you can see that the head of service has come. They always come to monitor the progress. Are you carrying out the mandate? And then they listen to all our presentations, which is data driven. And when they get back, because you can see the head of service, the Honorable Commissioner for Health, the Special Advisor to the Governor on Health, all of them were here on their way to the EXCO meeting because they needed to listen to the capture that what are you doing right and what are you doing wrong, so that they know how to continue to advocate for more allocation of resources to move the health system forward. It's all about achieving universal coverage. So that's pretty much why they were here, and they were impressed with the rendition because since inception in 2023, we compared the data to 2024, and they were here last year. Now this year, indices are getting better, and in the places where we have challenges, we have pointed it out to them, and they've seen. We have like 102% increase in family planning acceptors, and that is because as a district, we intensified efforts, integrated medical outreaches to the riverine areas, to the hard-to-reach areas, so we covered more clients, and now there's more sensitization of that. We recorded 0 maternal deaths in Ekpe local government and Etiosa. So now we're working on Ibejuleki as well. In Ibejuleki and Etiosa, 0 maternal deaths. But the one in Ekpe that we had a crisis, we are working on the situations that have changed because we transitioned from General Hospital to Federal Medical Center. So we're working on all of those things, and we've informed the top, personnel and all that. So all the innovations that we came out with, a QR code that gives us real-time online that what are the challenges. We have it as a voice prompt. We have it in Yoruba. We have it in, so that even the uneducated can tell us what the problems are in our PHCs. We review it daily. So we're doing all we can, training, retraining, and, learning, unlearning, relearning of our medical office, of our entire staff, so that better attitudes, so that we're not competing too much with the traditional birth attendants, because we need to look at that. We have a partnership with them. They should refer early and all of that, to us, so that we avoid this maternal deaths. We have the traditional medicine board with us as well, so that they can regulate these things. We have some unregistered and all. So all of these things are what we capture when we come for the retreat. Then at the end of the day is when we actually relax and unwind. But these are the first things we tell each other, because data is power, data is health. And that's why we chose the theme this year, advancing medical healthcare services through data-driven technology.
And trying to do to have a positive impact from the activities of those TBs. One of the things we've started is the process of redocumentation of the TBs. We have a lot of them in our data bank to the extent that some are not active again. So we want to redocument to find out who amongst them is still very active. So by the time we redocument, we intend coming up with a compendium, the compendium of traditional birth attendants that are licensed in the state. With such document, if your name is not there, which means you are not a licensed traditional birth attendant in Lagos State, with that document, we intend carrying out an advocacy. We want to use it to engage stakeholders to the extent that traditional birth attendants that doesn't have their name on that list is not worth patronizing. I think that will go a long way in fishing out quacks. And at the same time, we want to partner with the community, with the CDAs in our various LGAs, such that we will need intels as to who does what in their communities. All these quacks practices in the various communities, and they know themselves. So by the time we partner with CDAs, we want to be able to get information as who practices traditional medicine in their various locality. With that, we'll compare that listing with the compendium we have, such that those ones that are practicing illegally, we can now go after them to look for appropriate sanctions, or how we can reorient them to the right path.